Media practitioners have been urged to adopt responsible and ethical approaches in reporting suicide-related issues to help protect vulnerable persons, families, and support national suicide prevention efforts. The call was made at a workshop organized by the Association for Suicide Prevention Ghana in collaboration with the World Health Organization, WHO Ghana office, and the Department of Psychology, University of Ghana. According to the experts, reporting on suicide requires caution, sensitivity, and responsibility. The workshop aims to improve suicide reporting in line with the World Health Organization's upgraded guiding principles, as well as educating participants on the application of localized guidelines within the same context. The Association for Suicide Prevention Ghana emphasized the need for the media to avoid describing methods, location, or personal details of the victims who allegedly take their lives, while promoting help-seeking behaviors and available support systems. Professor Emmanuel Niboy Kwashi, President of the association, says suicide reporting does not follow the journalistic principles of 5 Ws and H, requiring a special approach to writing such stories.
These criteria may not fully apply to every suicide news. Again, there are times you may not have to follow all of them, because following all of them will mean that you are going to create problems for your reader or innocent listener or viewer out there. What we are saying is that, yes, suicide has occurred. Let the listening public or your readership or listenership know it. But make sure your report is on prevention and help seeking. So a little space for the news itself, but spend the rest of the space you have for educating or to educate the public about where to seek help, about facts about suicide, and letting them understand that it is a preventable health issue.
Professor Emmanuel Niboy Kwashi, President of the association, says excessive details, sensational headlines, and unchecked social media posts can do more harm than good.
Suicide is a reality in Ghana. At least you have not less than 8 people per every 100,000 people in Ghana dying by suicide, at least as of the end of 2021. It means that it's a problem on our hand. And at least from media reports, we know that many of the reported suicides, as we are seeing in the media, are happening among our young people. So we need to look at how we can prevent suicide. Now, suicide prevention can happen on 2 levels: population level and individual level. At the population level, one of the strategies is responsible media reporting. I have indicated earlier that if suicide is wrongly reported in the media, readers and vulnerable listeners out there will pick cues from the story and they will follow it. And that can lead to ending their own lives as well. And so our hope is that when we are done with this workshop, our media practitioners will improve the quality of their reporting of news items related to suicide. It will not just be about the incident of suicide or that case of suicide, but it will as well be packed with information and facts that seek to educate the public and let the public understand that suicide is preventable and there is help. And so people must seek help and where they can seek help. That way, we hope that we can reduce suicide over time.
Participants were taken through appropriate ways of covering suicide-related stories without exposing the public to harmful information.
We realize that in as much as the media plays a very important role, sometimes irresponsible report of suicide, can also, strengthen people's, intention to die. In fact, we have seen through our research that there have been several instances where media report of suicide has led to what we call copycat suicides. And we have seen that it is the particular way some of these reports are put out that really, reinforce the thoughts in people to die. And so this workshop basically is to help highlight this to the media personnel here and also to, help them to know how they can report suicide in a manner that rather enable people to seek solutions and not to die.
Professor Joseph Osafo Edu, clinical and health psychologist and the patron of the association, warns that social media content often trivializes and causes sensationalism, which continue to undermine prevention efforts.
They are pushing out information there that are not suicide preventive. Comments are unsavory. Somebody can sit and say, I heard that Kwesi wanted to take his life. He wanted to, then he or she has to open up to others for comments. And the comments are rather, deepening people's emotions in wanting to either abuse persons who are suicidal, who are going to suicidal crisis, or make comments on what you can take to end your life. Of course, that is not good. We just saw an example on one of the media platforms we don't want to mention here, that constantly somebody comes there to post, Ghanaian youth, you can take your life by doing ABC. And this has been ongoing for some time, and the managers are watching. Nobody says anything about that. So this is where our interest is. Draw their attention to this. Ask them to censor their own, website. Check what is happening there. Delete such comments. And then block such persons who come there to comment, because you don't know who the consumers are.
Dr. Pokia Oseyeboa, a mother who lost her child to suicide, shares her experience as part of her healing process, urging an improvement in public education and the provision of a support system.
I think there's still a lot of stigma. I don't know. I'm probably one of the few Ghanaians that will boldly step up and not be afraid to say, I lost my child by way of suicide. I don't know how many people will be willing to do that, because it's very stigmatizing. They're not looking at the triggers or what led to that. And so we need to find a way of having those conversations and advocacy. Suicide awareness seminars, suicide awareness presentations, a national hotline would be great. Because one of the things we have in the States is the 988, where people can reach out and say, I feel like harming myself. And then they can steer them to the nearest hospital to provide them a safe space. How do we get there?
Some participants spoke to the Ghana News Agency, expressing their commitment to contributing to national suicide prevention efforts through responsible journalism.
My knowledge on suicide reporting has been enhanced. The way you write, the way you present the stories and the facts has the ability or the potency to influence other people to copy, what you call the copycat suicides. And so as journalists, we have a very huge role to play. And I think the training shouldn't end here. We have to take it to our newsrooms. We have to inform our colleagues, even our editors, even people who are not journalists, but in our workplaces, media managers. The education should go down so that everybody will be at the same level, so that if something is wrong, someone can draw your attention. And so, all in all, it's been a very wonderful experience. And I think I would carry the message from here.
We have been exposed to some do's and don'ts that pertains to reporting on suicide. Now we are very conscious about the things that we should do and shouldn't do. So when we're writing now, I'm sure a lot of things will change. There will be a difference. We'll be more sensitive, more deliberate about what we write. And then again, I would like to commend GASP for this opportunity. I appeal that they give the same opportunity to other journalists to also learn, because when we are more, that's when we can make an impactful change.